So let's begin. So the first question, very short question stem, try and answer as quick as possible. Don't be so quick that you get the question wrong. Read every option, guys. I have seen suddenly in 1 second everybody answered, but everybody answered wrongly. So don't do that. Okay, take your time, read the options, but answer correctly. So accuracy always beats speed. Remember that. So I'll be giving you 30 seconds for each question. So you have some thoda kam time, but try to answer. Okay. Okay, so what do we have here? We have a child with dyspnea, first of all. Okay, so what did you see here on the X-ray, guys, that made a lot of you jump to thymoma very initially? So what do you see here? Can you all see that there is a very large mediastinal mass? Can you all agree it is centered around the mediastinum? It is not in one of the lungs. It is there in the center of the chest. So can we all agree that there is a mediastinal mass that we are seeing? Okay, so now whenever on X-ray I see a mediastinal mass, what is the investigation that will help me characterize it further? What is always the next investigation that we do for a mediastinal mass? Yes, it is not NCCT, Shiv Shankar, it will be CECT, all right? It will be a CECT that we will be doing, all right? So again, here what do you have? What do you see in this particular image here is what? Is it a CECT? Is it an NCCT? Is it an MRI? What are we seeing here? Yes, it is again a contrast enhanced CT. How do I know? Bones, white. All of these vessels are white. But what is this huge thing that I am seeing, which is displacing the mediastinum posteriorly? Can you all see this large mediastinal mass? Can you all tell me anterior mediastinal mass, middle mediastinal mass, posterior mediastinal mass? Where is this mass located in terms of a cross section? This is sternum, anterior. This is vertebra, posterior. So where is this located? Good. This is seen in the anterior mediastinum. Okay. Now the first learning point, the first category of learning that we are doing from today's class is going to be what? It is going to be the color of fat. Okay, so our first learning point today is going to be color of fat. Very plainly put, color of fat is what? Color of fat is black. Color of fat is black. As black as air? नहीं उतना काला नहीं but still kala. Okay, so how do I say that? So basically this is your kala of air, but not as kala as air. It is kala as the subcutaneous fat you have here, the fat subcutaneous fat that you have here. Can somebody tell Shruti how to watch it in the landscape mode? बस उसको ऐसे कर दो. I mean, it doesn't work that way. I'm not sure, but I think it should work. Okay, so basically, this is how the fat will be appearing on the CT. Nahi ho raha? I don't know, to be very honest. Try watching it on your iPad or laptop. ठीक है? But see, everybody, इसके बाद color of fat, remember, will be black. Okay, will be black. That is our very first learning. So everybody, can you see here? Can you see here that there is gray, there is black, and what are all of these white things here, guys? What are all of these white things that you are seeing? What is the color matching? Do you all agree that color is looking like the bone? Color is looking like the bone. It's like a bony structure, right? So here I have a mass which has, most importantly, fat, kala fat. It has bone and it has soft tissue. It has soft tissue. What is that mass which has everything? दांत भी दिखते हैं, बाल भी दिखते हैं, फैट भी होता है, सब कुछ होता है उस मास के पास. What is that mass which has fat? Very nice. It is teratoma. This is a teratoma. So our first learning point of the color of fat being black, it helps us diagnose any mass which has fat in it. And this is a very useful tool that radiologists have. We can identify fat without biopsying, without seeing it under a microscope. We can tell कि इसमें फैट है, ये इसके पास फैट है. Okay, so how does this help me define things? So teratoma is one lesion which has fat. Anything which has the word lipo, Do you agree that it will have fat? Anything which has lipo in it means it has fat. Okay, so this is how this color black helps me a lot to characterize a lot of these masses. Now I will see how much you have understood this in the upcoming questions. Okay, but before that, has everybody understood here? Okay, has anybody understood why this is not anything else? Why is it not thymoma? So Shruti, answering your question, thymoma, a soft tissue mass. It is a soft tissue mass, doesn't have fat. Diaphragmatic hernia will have herniation of bowel loops. Do we see any bowel loops here? No, I'm not seeing any bowel loops, so not a diaphragmatic hernia. Lymphoma, again, lymphoma will be a soft tissue mass. It will have lymph nodes, correct? Lymph nodal mass, again a soft tissue. So the presence of fat per se, the presence of calcification per se will tell me teratoma. Okay, on X-ray, definitely we cannot distinguish from thymoma, lymphoma. That is why we are doing CT, है ना? अगर तो हम एक्सरे पे बता सकते what is the point of CT? So the fact that X-ray only tells us that there is a mediastinal mass. Okay, that is why basically we need CT as the investigation of choice for characterization. Okay, age. Shivashankar, age. Remember, teratoma can be seen in a wide range of age groups. It can be seen in children also, middle-aged also. Okay, so age for teratoma, it's not very reliable. It is seen usually in any age group till the middle age. Okay. Right. So lymph nodes, again, you will see a soft tissue. I will show you lymphoma also today. I will show you how it looks. Okay. But for now, everybody has understood kala, fat, how to identify. Yes, all black is fat. Two things are black on CT. Air, very, very black. Fat, not so black, but still black. Okay. Calcification and contrast, it's a bit difficult. All right, it's a bit difficult to distinguish here, but then you won't see such a large vessel here, correct? You won't see such a large vessel here. It's more likely to be a calcification rather than a vessel. All right, everybody understood? Okay, so with that, let's go to the next one. Let's go to the next question. So very, very similar. Let's see. This is something which is going to be interesting. So a lot of these questions are going to be quite tough. Let me just give you a disclaimer. It's some sort of an extra edge class, all right, where you won't have very, very easy questions. Thode se tough questions hai. But even if one question comes from this class, like rest assured, nobody else will be able to answer it. Okay, so the level will be thoda sa higher for this class. That is how I've designed it. Okay, right. So thank you, Abhishek. So we have a 15-year-old boy who is having gradually increasing abdominal mass. Okay, so what do we see here? Again, something similar like the mediastinal teratoma that we had seen. Do you all agree? But now, which level are we at? Are we in the chest? Are we in the abdomen? Where are we? Or in the head? Where are we here? What cross section is this? You can all see this here. What are these? These are the bilateral kidneys, है ना? So we are at the level of abdomen. Do you all agree? Somewhere around L2, L3, L1, we are somewhere around that. And this is again a contrast enhanced CT. Do we all agree with this point so far? Okay. Now, can I identify the pathology here? It is quite glaring, correct? It is glaring and staring at my face here that there is a huge mass in this child's abdomen. Okay. Does this mass have fat? Does this mass have fat? Do you all recognize any blackness here from how we had studied teratoma? Is there any blackness here? Yes, wonderful. So you can again see that there is this black things which are going on. So there is definitely fat. Maybe that's why a lot of you see the lipo dekha and tukka mara liposarcoma versus lipoma, correct? But that is where the trap was. So it has fat, but along with fat, can you all see a few structures here which look like what? If I ask a layman, किसी layman को चलते फिरते आदमी को, if I show this thing, will they say कि इसमें हड्डी है? There are bones here, things which are looking like skeletal remnants. Do you all agree? किसी के skeleton के remnants लग रहे इसमें, है ना? So what are these? This is actually a very rare entity called fetus in fetu. What is fetus in fetu? It's a very, very interesting phenomenon where when we were babies, all right, suppose that when you were in utero, you had a twin brother or sister. For some reason, you ate that brother or sister. Okay, sounds very, very weird, but you ate your own brother or sister, and that brother or sister, the remains are living inside you. The remains are inside you. So when you grow up, this is basically gonna be like a mass. So do you see this fetus in fetu? All right. Yeah, I will not speak too much in Hindi, just a few anecdotes here and there, but grossly it'll be English only. Okay, so fetus in fetu is actually a remnant of a fetus inside the other fetus. Okay, so it's not actually eating it, but it's actually the process of resorption of the fetus. Okay, eating I have just said, so that now you will never forget fetus in fetu. Okay, so basically do not like say this around in your vivas ki fetus ko kha gaye, but basically it's the resorption of the fetus. Yes, because of which that fetus ke remnant parts will be there inside the other fetus. Okay, yes, it is possible. It is what you are seeing here right in front of you, right? So this is fetus in fetu, where you have fat also, you have bony remnants, it will not basically grow very very rapidly. Okay, as the child grows, basically it might appear as if it's increasing, so that is why very very gradually increasing. Okay, so yes, this has to be resected. This is like any other mass, this has to be resected. Okay, so you will, the presence of these bony vertebral remnants will help you distinguish it from any other thing. It has fat, but liposarcoma, lipoma will never have these bony remnants. Okay, so a very very rare case of fetus in fetu. Okay, for example, just forget that I have not added fetus in fetu. There are no vertebral or bony elements here, but just calcification. What is the other diagnosis I have to consider? Can I consider that there is an abdominal teratoma? An abdominal teratoma is a possibility. Yes. Okay, so again the same thing: fat, calcification, soft tissue. Remember the combination: teratoma, fetus in fetu is one extra edge pointer that you have learned today, and you will never forget it for the rest of your life. Okay, all the other differentials you're all talking about, we're going to be looking at everything. Okay, so let's look at one more question now. Starting now, go for it. So how to distinguish teratoma and fetus in fetu? The typical feature of fetus in fetu is the fact that you have to see bony remnants. Okay, some vertebra, some skeletal bone has to be seen to diagnose a fetus in fetu. Without that, we can't diagnose. Okay, that is the hallmark basically. Right, so very nice. So again, our color black is helping us. The color black is helping us. Do you all agree? Okay, again, tell me, what modality are we looking at, guys? What is the investigation we are looking at? All of you, I do want no doubts with modalities. Okay, we are studying at a very high level. I don't want you to get CT, MR wrong. Okay, so here, what do we have? We have the bones are white. Good. So it is a CT, contrast enhanced CT, NCCT. So we are again seeing kidneys appear white. The vessels also appear white. So this is a contrast enhanced CT. Now, again, what are the arrows showing within the kidneys? Do you agree bilateral kidneys have the lesion? Now, what are these colors? Again, you are all seeing black color. I can correlate with the subcutaneous fat, with the mesenteric fat. It's just the same color. So it has lipo. So my only job is to basically look for the options, but no, the options are not helping. So now, what are the renal lesions which have the word lipo? As all of you are correctly saying, angiomyolipomas are the renal lesions with fat. Renal lesions with fat, only one thing comes to mind: angiomyolipo. And whenever I have multiple angiomyolipomas, what syndrome comes to mind? Very very important. What syndrome? Yes, tuberous sclerosis. Hamartin tuberin, chromosome 9, chromosome 16, tuberous sclerosis. Now, I am asking you a twisted question. What kind of cutaneous features will you see in tuberous sclerosis? So now, you all know the Vogt's triad of tuberous sclerosis. What is the typical hallmark of Vogt's triad? All of you know epiloia. Correct. So epilepsy, low IQ, adenoma sebaceum. So this is adenoma sebaceum, the hallmark of tuberous sclerosis. You have acne-like lesions here around the root of nose. So this is adenoma sebaceum. Which syndrome do you see? Fibrofolliculomas. You have renal oncocytoma and fibrofolliculomas. What is that syndrome that I have taught you guys? Yes, Bert-Hogg-Dube. Bert-Hogg-Dube syndrome. What is that syndrome? Where you have myxomas. It is a complex. It is a complex where you have multiple myxomas. Yes, it is the Carney complex. Very nice. Carney complex. Which syndrome do you have? Axillary and inguinal freckling. Which is that syndrome? NF1. NF1. 1. Okay, so my speed, although a lot of you might feel I'm going very fast, but I want to just cover a lot of things in this 2 hours. I want to make every minute, with information. So I will go a bit fast. If you want to see it again, it will be better if you can just see it again. All right. If you miss out on a few points, you can just see it afterwards. The recording will be available. All right. Is that fine, everybody? Acceptable to all? Otherwise, if like बहुत ज़्यादा fast है, you can just tell me. I will just slow down a bit. Okay, so this is bilateral angiomyolipomas, tuberous sclerosis, adenoma, sebaceum. ठीक है, so this is about TSC. All right, let's look at one more lesion now. Okay, so it's amazing how I've only got one person who's answered it correctly. Okay, now I'm getting 5-6 people who've answered it correctly, but only 15% getting this correct. Treatment of choice, Abhishek, for angiomyolipoma. Remember, we can do angioembolization, we can do resection. Okay, so both are treatment options for angiomyolipoma. Okay, so what do we have here? There is a male, 35-year-old male, mild pain abdomen, a suprarenal mass is found. So what do we see here? Is it a renal mass? Is it an adrenal mass or a suprarenal mass? Can you see here on the coronal plane? Again, what is the investigation, guys? Bones is white, kidney cortex is white. So contrast enhanced CT. And what do I have? I have a well-defined adrenal mass sitting on top of the kidney. It is not a renal mass, correct? So what is the fat-containing adrenal mass? When I had a fat-containing renal mass, I knew angiomyolipoma. First of all, before I say fat-containing, do you all agree that this has fat? Do you all see the blackness? Do you all see the kalapan here to tell you that it is a fat-containing mass? Good. So what is the only fat-containing adrenal mass? So remember, adrenal mein you don't have angiomyolipoma. Adrenal has a very typical mass which has fat, which is called myelolipoma. Very, very important. So myelolipoma is the fat-containing adrenal mass that you need to know. Has lipo in it. It has myeloid cells. Okay, it doesn't have angio and myo. It has myeloid cells. Hence the name myelolipoma. Okay, so far, what all fat-containing lesions have we learned, guys? In the mediastinum, if I have fat plus calcification plus soft tissue, what are you going to tell me? What are you going to tell me? Yes, teratoma. So this teratoma can be anywhere, correct? It can be mediastinal, it can be retroperitoneal, but a combination of these three equals to teratoma. If I have a fat-containing renal mass, if I have a fat-containing renal mass, what are you going to think? Angiomyolipoma. If I have a fat-containing adrenal mass, what are you going to tell me now? Today you have learned a new thing. Yes, myeloid cells. Now you will see myeloid cells basically here. So this is a myelolipoma. All right, so these are the three things we have learned so far. Ready to explore more? Ready to explore more fat-containing lesions? Treatment of choice, again, myelolipoma, resect it. If the patient is symptomatic, you treat it. Otherwise, this is a benign tumor. You can just leave it alone. Okay, right. Next, again, let's see if it has fat or not and whether this helps us. Good. So good results here. 65% of you have given the correct answer. We have a child, 2-year-old child presenting with a gradually increasing neck mass. CT is shown here. I've already told you it's a CT here. And what do you have? You have a mass here. You have a clinical picture. You have a radiological picture. Does this lesion have fat, guys? Does this lesion have fat? All of these questions, Vendan, are designed that way that they are a bit extra edge. Okay, so I have designed this class in such a way that even if one question comes from this, like you guys will be the only bunch of people to get it correct. Okay, so that is the aim of this. Yes. So what do you see? Is there fat? So yes, Deepu has agreed. Everybody else, do you agree that there is fat inside this mass? You see here also there is fat, same color I'm seeing in the mass. है ना? So what? It does have fat out of the options, which is the only option to have the word lipo in it. Very, very easy. इस बार तो कोई twist नहीं था. It is lipoblastoma. It is lipoblastoma. So remember, this is a very important tumor. Okay. So when you have a fat containing neck mass, and this lipoblastoma is seen in children only. This is seen in children. All right. The central gray part is the soft tissue. Okay. So it's a lipoblastoma. So again, it will have a few soft tissue component also. It is not a lipoma. Only lipoma will be the thing जो पूरा काला होगा, which will have पूरा fat. Okay. So this is your lipoblastoma, a fat containing lesion seen in children. Remember, this is only seen in less than 2 years. After 2 years, it is not seen. The star is just showing the soft tissue component. Okay, looks like target sign. Fair enough, but remember, target sign is only seen in MR. You will not see target sign on CT, and target sign will be very tiny. All right, you will see very tiny fascicles in the target sign. All right, cyst, Aman, cyst will have a completely gray color. It will be completely like fluid. All right, so yes, all of you are asking about cystic hygroma. Remember, it will not have fat. It will have a gray color ka pani jaisa intensity. All right, it will have a gray color pani intensity. If it comes, I will show you. Okay, one hint that I would like to tell you, keep that in mind. Anytime they are trying to show you a cystic lesion, no, they will always give you ultrasound. They will always give you ultrasound. So use this trick in the back of your mind कि कभी भी वो cyst दिखाना चाह रहे हैं, they'll give you ultrasound as the picture. Making sense? Right. So this is a lipoblastoma, not neurofibroma. Thyroglossal cyst, typically in the midline, small cyst dikhega, again gray colored. Lymphoma, again will not have fat. Okay, everybody following this? So this is one pediatric mass that we have added to the list, lipoblastoma in the neck. Okay, let's see one more question here. Very good. So now we are exploring more neck masses here. So we have a 45-year-old woman who's presenting with gradually increasing neck mass. CT MR clinical picture has been shown to you. What is the diagnosis? Very nice. So 80% of you have given the correct answer. Wonderful. Yes. So all of you are talking about liar sign. Wonderful. ठीक है. So you all know about liar sign. That's great. Okay. So what do we see in this old lady? She has a neck mass here. What do we see on the MRI, guys? What do we see on MRI? Where is it located? So these are two black dots. Remember, on MRI, anything which are black dots are vessels. Okay, so on MRI, very good, Neil. Vessels will look like flow voids. इनको बोलते हैं flow voids, which means they do not have any signal. They will be kala because blood is flowing so quickly. The vessels will appear black. So what do we see? I see that the ICA and ECA is basically splayed by the mass. Can I use the word splay here, guys? Splaying. Do you all understand splaying? It means getting separated. So the ICA and ECA is getting splayed here by this particular mass. How is the mass? Can you all agree that it has white areas also, black dots also? So does it remind you of something called salt and pepper that we use everywhere? The salt and pepper sign. It has white areas also, it has black areas also. Now the clincher here, on the CT, what do you see? The fact that all of you identified that there is again splaying of the ECA and ICA. And what do you see? You see that there is a mass sitting here at the carotid sinus. So this is nothing but the carotid body tumor. All right, so this is very, very important. One extra edge thing. Can you tell me the classification that we use for carotid body tumor? Before doing surgical resection, there is one classification that we always assess. Okay, that is called the Chamberlain criteria. That is called the Chamberlain criteria to assess the resectability. Okay, so remember this Chamberlain. Liar sign is nothing but this splaying. The fact that it sits here at the bifurcation of the carotid artery, this is called the liar sign. Okay, the splitting of the splaying of the two vessels, typically described for DSA. All right, digital subtraction angio, maybe they can show you a similar image. Okay, everybody, this is clear. Carotid body tumor, no doubts. Chamberlain criteria. ठीक है? All right, going to the next neck mass. Okay. So 25% only giving me the correct answer so far. Right. So 30%, the time is adequate, right, guys? Those of you who've answered so far, the time is cool. You want me to increase or decrease the time, or it's fine? You are able to see all the images now. ठीक है. So what do you have? You have a young child here with oral swelling. It has been shown also somewhere in the base of the tongue. You are having this very red looking mass here. Now the CT will help us. First of all, you know it is a contrast enhanced CT. The vessels here appearing white, the bones here appearing white. So it's a contrast enhanced CT. All right. So first, let's look at this level. This is the level of the thyroid. Correct. What is this air containing kala structure? Not fat, but air containing kala structure in the midline. Trachea. What are these vessels here? These are the jugular and carotid vessels. Do you all agree? Jugular और carotid vessels हैं जो साथ में neck से जा रहे हैं. Now, what is supposed to lie between the jugular carotid and the trachea? यहाँ पे क्या होता है हम सबके पास butterfly shape का? What do we all have here which this person unfortunately doesn't have? What is this? Yes, the thyroid which was supposed to lie here. बेचारा thyroid is गायब. Where did the thyroid go? So the thyroid basically is up here. It has not formed the butterfly. It is just lying here as a single mass, which has clinically presented as this mass. So what is this? This is nothing but an ectopic thyroid. This is nothing but a lingual thyroid. When the thyroid during your embryology was supposed to go from the foramen cecum, remember, from the base of tongue, foramen cecum se niche jana tha. Alsi thyroid did not go. So what happened? It is stuck there. It is stuck in the ectopic thyroid, lingual thyroid. Okay, so everybody, how do I know this is thyroid? Remember, it will be very white, because what does thyroid have that makes the vessels also white? What is that thyroid के पास naturally है जो हम vessels में डाल रहे हैं? What is that substance? Iodine. Wonderful. So iodine thyroid में बहुत है. And what kind of contrast do I inject? I inject iodinated contrast. Now thyroid doesn't need any contrast. It already has the iodine, right? So remember, always it will appear intensely white. It will always appear white, whether it is NCCT or CCT. A thyroid will be white. Is this making sense? This feature will not be with any cyst. Bichara, all the cysts that you have here are all what? I'm just telling that Prerna will all have water. Correct? They are all cystic. All right, everybody understood? So these are all cystic lesions. They will not be white like this. Okay, understood all of you? So this is nothing but the lingual thyroid. Fine, everybody, very important image. हाँ, ये सबको समझ में आया? White color thyroid. No other cyst will mimic it. Okay, ranula. A lot of you thought ranula will also be seen here at the floor of the mouth. But again, it is what? It is a mucus retention cyst. So it will also be a cyst at the end of the day. ठीक है? Okay, let's do this question after this.